Today, let's talk about something almost everyone's dealt with, a sinus infection. Ever had one?
Oh, definitely. That feeling of pressure in your face, the headache, it's hard to forget. But do you know what actually causes a sinus infection?
From what I've read, it's usually an inflammation or swelling of the tissue lining the sinuses. Sometimes it's from a cold, or even allergies.
Right. And when the sinuses get blocked and filled with fluid, germs start to grow, leading to the infection. It's like your nose's version of a traffic jam.
That's a good way to put it. But I'm curious, do you know the difference between a sinus infection and just a regular cold?
Good question. Colds usually get better in a week, but sinus infections can last longer, like up to 10 days or more. Plus, the facial pain is much worse.
And I've noticed with sinus infections, people often mention thick, yellowish mucus. That's usually a telltale sign, right?
Exactly. The color and thickness of the mucus can be a hint. Plus, there's that annoying pressure around the eyes or cheeks.
It's almost like your face is carrying invisible weights. I also heard that some people get tooth pain from a sinus infection.
Yes, especially around the upper teeth. It's all connected. Sinuses are right above those teeth, so inflammation can cause that pain.
Speaking of symptoms, what about fever? Is it common with sinus infections?
Sometimes, but not always. If there's a fever, it might suggest a bacterial infection instead of just a viral one.
That leads to another question. When should someone actually see a doctor for a sinus infection?
If symptoms last more than 10 days, or if they're really severe, it's a good idea to see a doctor. Also, if symptoms improve and then suddenly get worse, that's a red flag.
Makes sense. But most sinus infections are viral, right? So antibiotics don't always help.
Absolutely. Antibiotics only work for bacterial infections. Using them for viral infections doesn't help, and can even lead to resistance.
It's tricky, though, because people often expect antibiotics to fix everything.
True, there's a lot of pressure to do something, especially when you're feeling miserable. But sometimes rest, fluids, and patience are the best medicine.
What about over-the-counter remedies? Do things like nasal sprays or decongestants actually help?
They can provide some relief, especially with congestion. Saline nasal sprays are pretty gentle and can help clear out mucus.
I've tried those before. The sensation is weird at first, but it does help me breathe easier.
I agree. Some people also use humidifiers to add moisture to the air, which can soothe irritated sinuses.
That's a great tip, especially in winter when the air gets super dry. But are there any home remedies you'd avoid?
Definitely avoid using tap water in neti pots. Always use sterile water. And don't overdo decongestant sprays, or you can get rebound congestion.
That rebound effect is the worst. Suddenly, you're even more stuffed up than before.
It's a vicious cycle. And speaking of cycles, why do some people get sinus infections over and over again?
Chronic sinus infections can be caused by things like allergies, nasal polyps, or even a deviated septum. Sometimes it's just bad luck with anatomy.
Allergies are a big one. If someone's constantly exposed to triggers like dust or pollen, their sinuses are always under attack.
So managing allergies might help prevent sinus infections in the first place.
Exactly. Sometimes doctors recommend allergy medications or even immunotherapy for frequent sufferers.
That's a lot to consider. By the way, can sinus infections ever become dangerous?
Rarely, yes. If the infection spreads to the eyes or brain, it can be serious. Symptoms like vision changes, severe headache, or confusion need immediate attention.
That sounds scary, but thankfully it's rare. Most people just deal with the pain and frustration.
True. It's mostly about managing discomfort and letting the body heal.
So to sum up, sinus infections are usually viral, can be super uncomfortable, but most clear up with time and care.
And knowing when to seek help is key, especially if things get worse instead of better.
Makes sense. Have you found anything that really helps you get through a sinus infection?
Honestly, rest, staying hydrated, and using a warm compress on my face. It's not glamorous, but it works.
I'm with you. Sometimes a good nap and some chicken soup are just what the doctor ordered.
And patience. It always feels like it lasts forever, but it does get better.
Before we wrap up, what's one myth about sinus infections you wish people would stop believing?
That green mucus always means you need antibiotics. It's just not true. Color alone doesn't tell you if it's bacterial.
That's a great point. And I'd add, not all facial pain is a sinus infection. Sometimes it's just a bad headache.
Absolutely. Understanding the symptoms can help people get the right care without panicking.
Well, thanks for sharing your insights and tips. Hopefully, our listeners feel a little more prepared next time sinus pain strikes.
And maybe a bit less anxious too. Take care of those sinuses, everyone.
And don't be afraid to ask questions if you're unsure. Your health is worth it.
Till next time, breathe easy and stay healthy.